Yeah, sure. I'd be happy to share with you what obstructive sleep apnea is. Obstructive sleep apnea is a condition where you stop breathing periodically throughout the night. What causes obstructive sleep apnea is when we start to fall asleep, the muscles in the neck area start to relax, and that causes our tongue to fall back into the back of the mouth and the throat area. When the tongue falls back in the throat area, it can cause the airway to become constricted. When that airway becomes constricted, the soft palate will start to vibrate, causing a noise that we're all familiar with, and that's snoring. Because snoring is such a familiar sound to many of us, a lot of times we think that snoring's okay, but actually snoring is a sign of a restricted airway, and when that airway becomes completely blocked, someone will stop breathing. A person can stop breathing hundreds of times during the night, and as a result, their vital organs like the brain and the heart don't receive enough oxygen, and many times this can have some deadly consequences. Yes, you're right. Sometimes until a celebrity is afflicted with a disease like this, the disease will become more familiar to the public. And you're absolutely correct. Reggie White, the Hall of Fame NFL player, did die as a result of sleep apnea. Well, the problem with that, like you were saying, is many people who suffer from sleep apnea don't even know they have it. The biggest challenge today in obstructive sleep apnea is really proper diagnosis. It's relatively easy today to determine what form of obstructive sleep apnea someone may have through an at-home sleep study, which measures many critical factors and allows a person to be tested while sleeping in the comforts of their own bed. Yes, that is correct. Once a proper diagnosis of obstructive sleep apnea has been determined, there are several treatment options that can be used. These treatment options can range from lifestyle changes like a weight loss program to the use of what's called an auto-PAP or a CPAP machine, which provides temporary or continuous positive air pressure. And there's also the use of a simple non-invasive dental appliance. Well, I'm glad you're asking about obstructive sleep apnea because so many people are unaware what a serious condition it is. For anyone who wants more information about obstructive sleep apnea, they can call my office and we'd be happy to send you out more information. Thanks.